Today's episode of Parenting Great Kids is brought to you by Life on the Fast Track podcast. From Slate, in collaboration with Ford, comes the new podcast, Life on the Fast Track. Cheer on three girls as they design, build, and race wooden cars in the Ford Girls Fast Track races. You'll meet their families, use power tools, and hear what happens when girls are empowered to put STEAM principles to the test. Download and subscribe to Life on the Fast Track wherever you get your podcasts. And by GoGo squeeZ. For a healthy and delicious snack that lets your kids explore, play, and be their best, you've got to try GoGo squeeZ. GoGo squeeZ is made from 100% all-natural fruit with no artificial anything. Nothing but orchard fresh apples and other wholesome fruit, all in a squeezable pouch that's ready to go wherever they go. There's over 25 tasty varieties kids will love and that you can feel great about too. GoGo squeeZ, fruit on the go pouches. Find them in the applesauce aisle today. For 30 plus years, I've seen every type of child grow up.
Instead of giving me what I wanted, she gave me what I needed, which was truth.
Don't let emotions win. Let truth win.
Do your very best, and you should have a lot of fun while you do it. And the better you get at something, the more fun you're going to have at something.
You moms and dads are wired with everything you need to be a parent to a great kid. Welcome to Parenting Great Kids. This is episode number 47, Children and Anxiety. I'm your host, Dr. Meg Meeker. You know, friends, one of the topics that I feel strongly about that doesn't get enough attention or discussion today is that of anxiety and our kids. When it does get addressed, I often see parents and pediatricians rushing to medicate kids too quickly before employing other treatment techniques, and that really concerns me. So today, I'm going to be interviewing my friend and colleague, Dr. Sander Weckstein. Dr. Weckstein is a child and adolescent psychiatrist, board certified in both adult and child and adolescent psychiatry, and he has practiced psychiatry for over 20 years. He is extremely well-versed in medication and different psychotherapeutic techniques. He's associated with Munson Medical Center and has extensive research and experience in the area of treating anxiety in children as young as 3 years old. We had a wonderful discussion about how parents can better attend to anxiety issues in their children, and I can't wait for you to hear it. And by the way, if you're a parent who struggles with anxiety, this episode's going to help you as well. Also in this episode, I'll be featuring a listener question from a mom struggling with behavioral issues in her gifted 10-year-old daughter. As always, I'll share my points to ponder so you can start using them right away. And parents, remember, don't just download the episodes, click subscribe. Because when you do that, you're joining my parenting revolution and every new episode will automatically show up in your subscribed list. And I'd love for you to write us a review on iTunes. Let me know what you think about the podcast. Not only are we on iTunes, but the Parenting Great Kids podcast is also available in the Google Play Store and on Stitcher. So no matter where you get your podcasts, subscribe today and don't miss a single episode. So parents, thanks for listening. Stay with us. So here are my points to ponder. Point number 1, never be afraid to look at anxiety in your child. You know, friends, when it comes to our kids not feeling well, particularly when it has to do with emotional issues or psychological issues like depression, anxiety, it pushes a lot of buttons in us parents. And sometimes when our buttons get pushed, we recoil, we push back. And rather than facing what we need to face, we like to pretend it isn't there. But as you heard Dr. Weckstein talk about, don't do this, because when you fail to see that your child is struggling with anxiety, or you fail to help your child get help for his anxiety, i.e. avoid his anxiety altogether, you actually make that anxiety in your child worse. So don't do that. You know, you'll often hear me say, don't parent out of fear, parent out of strength, particularly when it comes to emotional issues that your kids may be struggling with. Don't be afraid. Dive in. Help your kids. If you feel your son or daughter, whether they're 3 or 5 or 13 or even 17, may be struggling with anxiety, you see, change in appetite, change in their mood. They're very agitated. They're irritable. Their grades are falling. They just don't seem like themselves. And you think that anxiety may be the issue. I encourage you to start by calling your pediatrician and asking to come in and sit down and have a heart-to-heart. You can talk with your pediatrician alone, or you can bring your child. Either one is perfectly fine. I actually recommend that you bring your child so that you can help your child deal with any kind of problem right out front. Be very matter of fact. Pretend you're dealing with a child who may have a broken arm and talk very matter of fact about your concerns about him or her having anxiety. Then ask your pediatrician for recommendations for next steps. Your pediatrician may recommend that you go see a good therapist in your area. Make sure if you go to a therapist that that therapist is well-versed in pediatric issues. Make sure you don't take your child to an adult therapist. You want to make sure that your therapist knows how to deal with young kids, teenage kids, whatever age your child is. Talk with your doctor about whether or not your child may need a psychiatrist. Does he need medication? Should you have him evaluated? But most importantly, don't be afraid to look at the possibility that your child may be dealing with anxiety. Second, you need to take charge of the stimulation in your child's environment. Your child needs you to take control over his environment. So take an inventory of what is coming at your child. How much auditory stimulation is your child getting? How much visual stimulation is your child getting? How much social stimulation? How much academic stimulation? The truth of the matter is our kids are bombarded with stuff to do, things to hear, things to see, and their young brains aren't meant to have to absorb so much stimulation. So take charge of what's coming at your child. Look at how much time he's spending on a screen. And you need some very strict rules about screen time in your kids, because that's a big area of overstimulation for our kids. If you have a young boy who's dealing with anxiety, don't let him sit there and play hours on end in front of a video game. If you have a daughter who's dealing with anxiety, don't let her be on social media more than maximum 30 minutes per day. And in my book, I think no social media is best. Look at television shows they're watching. Look at activities that they're in. Look at the overall stimulation in your child's environment. Pare it down. Bring quiet into your child's world. Bring boredom into his world. So remember, to whatever degree you can help calm your child's world and dial down the stimulation in his or her life, you are really helping him or her step out of living in constant fight or flight mode. Point to ponder number 3. Start with the basic 4. Good food, good sleep, good exercise, good connection. As Dr. Weckstein says, the nutrition that our kids take in is very important. So in the morning, start with a high protein breakfast. That will really help. Make sure your child is getting good sleep. If he or she is struggling with anxiety, help them try to get to bed a little bit earlier. Decrease the amount of stimulation going on right before bed. You want really good quality sleep. So implement a bedtime. If your child needs more sleep, then you need to help him or her get to bed earlier in the evening. Good exercise. Kids need to be preferably outside playing for at least 30 minutes every day. If that's not possible for you because you live in the city, make sure that your child is exercising outside. Make sure he's in a soccer class, ballet class, a dance class, or something where he or she is moving their body, getting their heart rate up for at least 30 minutes every single day. If you can't do 7 days a week, that's okay. 4 or 5 days a week is perfectly fine. And good connection. It's really important that you connect with your child on a daily basis. And this means spending good time with your kids, eye-to-eye contact. Go outside and kick around a soccer ball. Play a board game with your child. Take your child out for lunch once or twice a week. Just, you know what you would want if you wanted the person you love the most in your life to spend more time with you. You know how you would like that time to go. You know how you would want to connect with that person. You would like that person to hear you, to see you, to listen to you. So offer that to your child every day. Touch down with your child. So point to ponder number 3, good food, good sleep, good exercise, and good connection. Parents, we all know that talking with our kids about sex is uncomfortable. And when it comes to having that initial talk with your child about sex when they're about 8 years old, I always say in every couple there's one who's a chicken and one who's an even bigger chicken who just won't have the talk at all. But the truth is, no matter how uncomfortable it is, beginning a conversation about sex early with your child is extremely important because it puts you in the driver's seat. The tricky part is many parents often don't know where to begin or where to end. What if they say the wrong thing? What if they talk too much or too little or use the wrong words? Too often, not knowing how or when they should approach the topic of sex with their child, many parents just don't do it. And then this leaves your child at the hands of the culture or his friends to teach him about sex. I have created a digital toolkit just for you called How to Have the Talk with Your Child. It walks you through the process of having that initial conversation with your child about sex. The toolkit's packed with a variety of resources and all the information you need to get ready to have that initial conversation, including ages and stages chart to help you determine when to have the talk with your child. There's an ebook on talking to your child about sex, a script to help guide you through the discussion, and for those of you who are really chicken, you're the big chicken, it even includes a video of me giving the talk directly to your child. How easy is that? Talking to your child about sex doesn't need to be intimidating or scary. It can be really a great experience, and it'll help you establish a strong relationship with your child. I'm excited to offer you How to Have the Talk with Your Child toolkit for 20% off. Just go to my website, megmeekermd.com, click on Parenting Resources, and user code TALKPODCAST when you check out. Parents, this topic about sex is far too important to hand over to somebody else to talk to your kids about. You need to do it. Go to my website, check out How to Have the Talk with Your Child toolkit, 20% off. You need to stay in the driver's seat when it comes to talking to your kids about sex, and I'm here to help. Parents, I want to invite you now to listen to a wonderful conversation I had with my friend and colleague, Dr. Sandra Weckstein. Well, Sandra, thanks so much for joining me and talking about kids and anxiety today.
I appreciate being here, Meg.
Yeah. Now, as a child and adolescent psychiatrist, you've got a really busy practice. Take us through your office doors and tell me, what are the most common psychiatric or psychological issues that you see on a regular basis in kids?
Well, probably the most common one in some form or another is what we're talking about today, anxiety or anxiety disorders. Though I also see a lot of kids with some form of a mood disorder, either depression or bipolar disorder. Mm-hmm. I see lots of kids with autism spectrum disorder. That's probably a quarter to a third of my practice. Lots of kids who have ADHD, lots of kids who have tic disorders or Tourette's disorders, lots of kids who have specific learning disabilities. And then as we have learned over the years, it's much more common that you have overlaps or comorbidity. So I see the majority of kids who have overlaps of one or two or three of those things as opposed to any one alone.
So you can have kids. So if you're treating a child with anxiety, there's a pretty good chance that you're also treating something else. So a child with depression may have anxiety, or a child with ADHD may have anxiety. Is that pretty fair to say? So anxiety can cross over with a lot of different issues.
Absolutely. And in my mind, that's why it's really important to try to do a thoughtful evaluation, because if you're making an assumption or only treating one part of that puzzle, the likelihood of you having successful treatment or optimal treatment is less.
Well, let's sort of hone in for a minute on just anxiety. Understanding that you could be treating as a psychiatrist, or a parent could be dealing with a child who has anxiety plus something, or just straight anxiety. So just for a minute, let's back up and deal with just anxiety. Have you seen a rise or a fall of the prevalence of anxiety over the past 20 years? Because you've been at this a long time now.
I have. And I would say absolutely a rise. And that's true of all of the major neuropsychiatric issues, but anxiety, definitely. And in general, probably 20 to 30% of kids at some point in time would meet criteria for having a diagnosis of an anxiety disorder.
20 or 30% of all kids, not just kids who come in your practice.
Exactly. And that, reflects in some really striking information that, I've talked with a lot of primary care practitioners about, which is, when you're seeing a kid in your practice, at least about 20% of the time when they're coming in for something, could be a sore throat, could be a stomachache, could be something different, either their chief complaint relates to that anxiety or anxiety affects their presentation.
Let me sidetrack for 2 seconds. Are we as primary care providers picking up on that in general?
I think it depends on the primary care provider. I think I've had the pleasure, of working with you with lots of kids together over the years. And I think you're a little bit like me, a little bit of a dinosaur, and you work on having the time to really get to know families. And I think the likelihood of your picking up on that is much, much higher than, unfortunately, some of the new providers who, either by managed care or other factors of practice, need to spend or feel they need to spend less time.
So if parents out there have less time with their doctor has less time with them, their pediatrician, it's really more on their shoulders to figure out, wait a minute, I need to do a little detective work here so that when I go into my doctor, I can say, I think Johnny may be struggling with anxiety or not. So that's why I think podcasts like this are really important, so we can really educate parents to say, you need to really advocate for your kids. So what do parents need to watch out for? What are some of the signs and symptoms of anxiety in an otherwise healthy child?
Well, there's a lot of signs and symptoms because anxiety has lots of types. And just like chocolate or vanilla or strawberry ice cream is all ice cream, they all taste a little differently. So anxiety has lots of different types. So you can have kids who initially present with anxiety, particularly when they're younger, with lots of physical complaints like headaches or stomach aches or other apparent medical issues that, when evaluated by a pediatrician or primary care doctor thoughtfully, does not appear to really have a body-based cause. Mm-hmm. Other kids, on the other hand, can be who have anxiety can be irritable or sad or oppositional or angry or overwhelmed. A lot of them are hypersensitive to changes in their environment or their parents' mood or peer perception or constructive criticism, which gets back to what you said. I think parents have a really good gut level. And in general, I encourage them that if their gut level is ringing and saying something's wrong and they think that it's anxiety, to talk to somebody about it, to learn more about it, and then to be good advocates for their kids, talking to a primary care physician, therapist, psychiatrist about it.
I wholeheartedly agree. Many, many years ago when I first went in private practice, one of my older mentors said to me, if mom comes in, it would be dad as well, and says something's wrong with her child, don't let her out of the room until you figure out what it is, because she's right. And I think you're absolutely right. And I encourage parents to trust their gut. If you're a mom or a dad listening and says something's wrong here, then something's wrong. So advocate for your child. And I know it's really hard because in the medical system, we're all so busy, we physicians, but really advocate for your child. So let's talk about specifically what parents, aside from feeling that gut instinct, something's wrong here, my child may be anxious, or gee whiz, Johnny doesn't want to go to school because he has a stomach ache every morning. Talk to me a little bit more about how parents can sort of say, I think that my child may have anxiety. I'm going to do a little bit of detective work. What do you tell them to do?
Well, that takes me on a little bit of a segue to get people to think about anxiety basically as our fight or flight response that's gone awry. And as humans, we have developed this amazing response to true danger that helped us stay alive as a species.
Yeah.
Unfortunately, over time, that has been hijacked, and we have more false alarms because we live in a more stressful society, doesn't have those acute dangers, but we have chronic stressors. And so if you think about that fight or flight response that happens in a blink of an eye, that if you will, we see danger, and even before our brain registers it, that impulse goes to an area deep in our temporal lobe called our amygdala. And our amygdala immediately functions to cause that alarm system going, releasing neurohormones and chemical messengers, epinephrine, norepinephrine, cortisol into our body, and our body gets ready to fight or run.
Right.
And so if you think about that, our blood starts pumping, our heart races, getting blood to our large muscle groups to help us fight or run. Our breathing increases to oxygenate our blood and muscles and brain, getting us ready to fight or run. Mm-hmm. All of the blood that's gone to our gastrointestinal system is shunted to our brain and large muscle groups, again, and getting us to fight or run. And with those things, we have symptoms. People feel their heart beating faster. That's a symptom of anxiety. Mm-hmm. They feel themselves breathing faster. That can be a symptom of anxiety. They feel themselves shaky or sweaty. That can be a symptom of anxiety. They got stomach aches and gut issues. That can be a symptom of anxiety. So that fight or flight response gone awry is those symptoms of anxiety.
So really what you're saying is our kids are living in an environment where they're getting a lot of triggers that are frightening, obviously on a subconscious level. And they're just kind of overreacting, not because they want to, but that's kind of how they're wired. So their kids with anxiety are living in sort of a constant state of fear.
I think that's a very accurate assessment of things. And then there's that interplay because, as you know, our society has changed so much over time that has also kind of contributed to that. Where in the past, if you will, the majority of us did a lot of physically intensive exercise, we're more a sedentary society. And exercise is great to help prevent anxiety and treat anxiety. Right. In the past, we, ate because we needed that nutrition for our brains and bodies. And now there's a lot of junk food, unhealthy foods that taste good that we eat just to eat, not because we necessarily need that nutrition.
Right.
In the past, even though I would tell you that technology can be great, we didn't have those types of technology. And in today's day and age, kids are bombarded, unfortunately, from a very early age, not only by TV, but overstimulating things on the internet. And that can cause anxiety and get our brain going in unhealthy ways. And then I guess finally, there's been kind of the breakdown of our family unit. And it is more common or as common for parents to be single parents than there to be two parents raising a child. And that's really stressful for a family system.
Yeah.
And I think all those things have contributed.
So we're really having these little people, 3 years old, 7 years old, 15 years old. I still consider an 18-year-old a little person. I mean, they may be big. They may be bigger than I am, but they're still little. We're having these wonderfully sensitive, lovely people who, it sounds like you're saying, are constantly stressed by incoming stimulation, that their body is sort of responding with fear in a way, and they really just don't know how to cope with that. Is that fair to say?
It's absolutely fair to say, Meg. Unfortunately, our environment is overwhelming at times and stressful. That, along with genetic loading, kind of is a final common pathway of us presenting with anxiety symptoms. And it's kind of on a technical way of describing it. Our amygdala is that area in the deep part of our temporal lobe that is that fight or flight response. And now it's hijacked, if you will, the logical parts of our brain, our orbital frontal cortex, that front parts of our brain that is logical thinking, organization, planning, time management, working memory, empathy, all of those things that are useful in helping us to problem solve, we don't do when we are overly anxious. We don't think clearly. So
we really but I'm talking about anxious children here, live in a state of just react. They don't go, wait a minute, here's a reaction, and then have a parent or them sit down and problem solve or recruit whatever part of their frontal lobe they can at 10 to sort of say, okay, here's my response, and this is what I need to do. What I'm hearing you say is they react constantly without ever solving a problem in the moment. And it just all kind of piles up on each other. Is that right?
It is. And then the natural tendency when on any of us have anxiety or something uncomfortable is to avoid it. That's natural. But unfortunately, that is the exact opposite of what we want to do with anxiety. Because when we avoid it, we get more sensitized to it and it grows. Even though in the short run, we feel a little bit better.
Can you repeat that? That's an outstanding point. I need you to repeat that because I want everybody to hear that. Our response to anxiety is avoidance, correct?
It is. It's our natural response. And it makes sense because it's uncomfortable and we don't want to feel that. The issue is when we avoid it, we get more sensitized to it or it grows. Wow. On the other hand, if we can recognize that with the help of our parents, if you will, and their realization, and we can confront it or face it, at first, it really is uncomfortable. And that's hard. But as we continue to face it, given tools, our anxiety diminishes and shrinks, and we feel better. And that, in essence, is the treatment of anxiety, both in terms of prophylaxing us from developing worse anxiety and treating it when we have it.
Well, and I will tell you, you know really what you're talking about because our listeners need to know, and you've how to really successfully treat anxiety because you're one of the best in the country. I really do as far as treating children and adolescent anxiety and mood disorders. So let's talk about two things. First of all, there are some kids who live in our environment who seem to not have anxiety and they float along and they do okay. And they have a lot of overstimulation and a lot of triggers, just like other children who have overstimulation and triggers, but respond with anxiety. Is that just a genetic issue? Or why is it that some kids are really anxious and some kids aren't? And maybe they have similar kind of home settings, stimulation, and so forth.
Great question. It's usually multiple things. One is that genetic loading piece. And I guess I'd look at an analogy. Let's pretend you and I were in a room and you're allergic to cats and I'm not. So we're both around cats and cat dander. Your allergies or sensitization make you set off that you have this response where your eyes water or you get itchy or you have a hard time breathing. I'm exposed to that exact same situation and I don't respond in that way at all. So that's that sensitization genetically that we have. Then there's that environmental piece. So if you have parents who, for whatever reason, realize the things that we've talked about and can help their kids to gradually face their anxiety, giving them their message with both their words and actions that they're capable of doing it, that nothing bad is going to happen. It's just worries. It's just uncomfortable. Those kids are more likely to not develop worsening anxiety, even if they have that genetic loading. And if they don't have that genetic loading, it helps to prophylax them from developing it further in the future, even when stressful things happen.
So what you're saying to me is if I'm a parent with a child with anxiety, I need to be tough enough as a parent to say, you've got this, we can do this, you don't have to be afraid. The difficulty for me as a mother would be, wait a minute, I don't want you to hurt. So I want to kind of protect you. I can't have you do that. So how do parents do the hard stuff in helping a child with anxiety?
Yeah, you've hit the crux of helping to treat anxiety, which is most parents, understandably so, want to help their kids feel better and not hurt. When your kids are hurting, it's the worst thing in the world. So naturally, we want to scoop them up and make them better. If you're not prone to anxiety, that probably works really well overall, that comfort, that reassurance. On the other hand, if you're prone to it, you have that genetic loading or you've had a lot of stressors, whatever the reasons are, that scooping up and making them better or trying to gives kids the words and message inadvertently that they can't handle it, that their parents have to scoop in to do things. And what you want to do is be aware of that, and then that awareness saying, wait a second, I have to understand that what I'm doing is now going to be counterintuitive. And I trust my pediatrician, my child and adolescent psychiatrist, my whoever's working with them, that they really understand my child and me and are going to give me a format to help my child beat their worries. And that format is going to be my work as well as my kids' work. And my work is going to be giving them the message with my words and actions that they can handle it and rewarding them when they try. Their work is going to be working with a psychiatrist, a therapist, if you will, that I would view as a coach, to learn very good coping skills, which are kind of referred to as cognitive behavioral therapy. And then with those coping skills, learn to face their worries. And it's hard work, but it's extremely successful. It's extremely rewarding and very, very effective. And I've had kids, I've had the pleasure of seeing kids and families longitudinally over 25 years. And I can tell you it's probably my favorite group of kids to treat in the context of therapy or combined with medicines because they typically do so well with treatment.
And Sandra, that's exactly why I wanted to put you on, because we're talking about an issue that affects so many hundreds of thousands of children and families. And having anxiety is frightening for children and for parents. But your message is it's treatable. And my message to parents is, I've seen you successfully treat it. So dealing with an anxiety disorder in your child is nothing we should shy away from. We should say, let's walk into it and do this because this is treatable. We know how to manage this, how to teach people how to live with it, and how to live a much, much healthier life. So let's talk about if a parent has a child who's 7 years old or 15 years old, because age really doesn't matter here, because we're talking about children from 3 years of age up until, 21 or whatever. We're talking about children and adolescents. A parent suspects their child may have anxiety, which could come out as panic attack, constant fear, stomach aches, doing poorly in school, a lot of different ways.
Yes.
Because in kids, everything comes out sideways. They could be just screaming at everybody all the time, and their underlying issue is anxiety. So a parent thinks a child may have it. They go to their doctor. They get a diagnosis of anxiety. So now walk me through what that parent is going to need to do to help that child overcome anxiety.
Well, the first piece is educate themselves, because knowledge is power. And the more they know about what's going on, the better and healthier decisions they can make to address the problem. And anxiety disorders are so treatable, but just like other things, take some hard work and have to realize that from the get-go. The first piece goes back to basics: good, healthy nutrition, consistent aerobic exercise, good sleep, staying away from excessive technology use, extremely important. There is no simple, easy fix. And unfortunately, we live in a society where we often want those simple, easy answers for complex questions. But after a diagnosis is made, the first part of treatment is education and getting kids and parents to understand that concept of a false alarm that we talked at, that their body is acting as if there is danger when there is no danger. It's saying, danger, danger, even though there's not.
Right.
And parents and kids need to come to understand that avoiding it in the short run, again, makes them feel better, but in the long run, it causes anxiety to worsen.
So walk into your anxiety. Parents, I hope you're enjoying my conversation with Dr. Weckstein. We need to take a quick break, but don't go anywhere. We'll be right back. If you're looking for life insurance in the new year, check out Ladder. It's the quick and easy way to get life insurance online. It's the 21st century. You shouldn't have to wait for weeks to get your life insurance in place. With Ladder Life, there are no commissioned agents and no policy fees, and you can be done in minutes. Visit ladderlife.com/Meg and answer a few quick questions to get a free quote. If you like what you see, you can apply and get an instant decision on fully underwritten life insurance in less than 10 minutes. Coverage can start today if you qualify. Ladder provides customers with a quick application process that saves you time and frustration because you answer only the questions that are relevant to you. Coverage is available from $100,000 up to $8 million. Ladder's dynamic life insurance lets you get something in place now and apply for more or decrease your coverage with no penalties or fees. With Ladder, you get instant decisions and instant peace of mind. Visit ladder.com/Meg to get a free quote and get life insurance checked off your list today. Parents, you expect the same high-quality, clean-label nutrition for your kids as you do for yourselves, right? But all too often, we have to compromise when it comes to snacks. Thankfully, now there's RXBAR Kids, a clean-label snack bar made with high-quality, real ingredients designed specifically for kids. With egg whites, fruits, and nuts as the base, RXBAR Kids contains 7 grams of protein and have absolutely no sugar, gluten, soy, dairy, or bad stuff. And with 3 flavors, including chocolate chip, apple cinnamon raisin, and berry blast, they're perfect for any time kids want something tasty and filling like breakfast on the go or as an after-school snack. I tell you, friends, I've eaten the RX Bar and I've given them to my grandkids and they're wonderful. You can find RX Bars at Target stores or for 25% off your first order, visit rxbar.com/Meg and enter promo code MEG at checkout. That's rxbar.com/Meg, promo code MEG for 25% off your first order. So you talked about nutrition specifically with children. You want them to avoid junk food, I assume.
Yes.
Give us some nutritional guidelines, just a couple.
You know, I'm not a dietitian, but in general, I look at the healthier the foods, the better, farm to table if you can, because you know what you're eating and where it comes from. Food with protein in the morning, if you can. And then the biggest piece is avoiding or eating less consistently that really junk or unhealthy foods. Mm-hmm. You know, all the snacks, all the things we love to eat because they taste good, or fast food, but that really is not good for our brain and body, as you know.
Talk about sleep. How much should a 7 or 12-year-old be sleeping at night? And obviously anxious children don't want to sleep. So how do you coach a parent through healthy sleep for kids?
That leads me into first talking about exercise, because that's an easier thing to coach through it first. And great data that exercises kind of releases brain-derived neurotropic growth factor, which is the elixir of life for our brain. And it helps with so many things. One of that is anxiety. And again, we live in a more sedentary society. But if you can get kids, in addition to their normal stuff, to be trying to get really 30 minutes or more of aerobic exercise a day, it does amazing things to our brain. It downregulates our brain. It releases brain-derived neurotropic growth factor. It helps nerve cells grow, and it helps synapses become more, and it helps myelination. It does all this good stuff, and it helps us to sleep.
Yeah. So if I have an 8-year-old, and I'm not going to send my 8-year-old to the gym or say go for a jog for half an hour, do I just... what's the equivalent? Do I just say go outside and play? How do I regulate exercise in an 8, 9, or 10-year-old?
Yeah, going out and play is a good thing, but even a better thing, if you can get to do it, is playing with them. Because if you're spending your time and giving them your attention and modeling what you think is healthy, they're going to follow that a lot more likely than if they go outside to play by themselves or with a friend. And then you can regulate things. So you can go for a faster walk with them and make it aerobic while you're talking about interesting and fun things. And you might add little bits of jogging in there and then go back to fast walking. Mm-hmm. You can do jump rope with them. You can play soccer and practice that. There's so many good, fun ways to get that exercise. But unfortunately, it takes some work and some time. And in our society today, that's a premium that people don't always prioritize.
Which is kind of sad, because we're talking about treating anxiety in kids. And we need to prioritize the emotional and psychological health of our children as parents. That's just the way it is. So we've talked about exercise and diet and sleep. Let's talk about therapy in kids and medication in kids. Yes, no, how much, how long?
So therapy, 100% yes. And the term would be cognitive behavioral therapy, because that is a very well-researched form of therapy that helps kids to face anxiety along with their parents. Mm-hmm. And think about a sports analogy. If you wanted to be the best basketball player ever, if I'm talking to a boy in my office who really likes to play ball, I ask them what they'd want to do and how they'd get there. And then I'll lead them down the path, which is, you have to have maybe a little bit of talent. Even more importantly, you have to work hard. And then when you're doing those things to practice, if you're really serious, you'll get a coach. And that coach is what I would view as the psychiatrist providing cognitive behavioral therapy or the therapist providing cognitive behavioral therapy. Mm-hmm. So first you explain the things that we talked about avoidance making it worse, about facing it down. Then you get parents and kids buy-in, because unless both of them buy in, the likelihood of success is smaller. You have parents reward their kids with time, attention, and even tangible rewards for facing their worries, because that's important. And then in an office setting, the therapist or coach first teaches kids strategies to help calm down their body. Because when you have that false alarm, your body reacts with all those autonomic symptoms that we talked about. Mm-hmm. And the easiest way is tensing and progressively relaxing different groups of muscles, having certain types of what's called diaphragmatic breathing or belly breathing, which accesses our parasympathetic system that counters that fight or flight response and helps us relax, and then pleasant visualization. And by practicing those enough, you get better at those. And if you practice them when you're relaxed, it's a lot easier to practice them when you need them, when you're stressed. Just like in basketball, if you practice when you're not in the game and you get into a pressured game, muscle memory takes over. And it's a lot easier to do the things that you need to do. So that's the calming down your body piece.
Can you or a therapist teach a 6 or 7 or 8-year-old child to do that?
Absolutely. I would tell you my probably youngest kids that I think I've done that successfully with, though you have to be a little bit more creative because of their developmental level and make a lot of it play and fun, is probably at the age of 3 and 4.
Wow.
You can begin that process successfully. It's pretty amazing. The cognitive part gets a little bit more tricky because that's when you're teaching kids to be good detectives. And in essence, you're saying to them, it's not a situation that makes you feel sad or mad or scared. It's how you think about it. And sometimes when you have those strong emotions, you have really fuzzy thinking, unclear thinking. Cognitive distortions is the technical term. And so as a therapist or coach, I need to teach them to be good detectives about what's going on in their body, but more importantly, what they're thinking, because they're often having catastrophic or negative thoughts that they take as 100% truth when it's their worries talking that is lying to them.
Right.
So they learn to do that, and then they learn to argue back with those worries with certain techniques. And then you put those two things together, or those body-based techniques to help them relax, the cognitive strategies to talk back to the worries, and then with their parents' help, you gradually help them to face their worries. First in your office setting, and giving them success and rewarding them, and they feel great about that, as you might imagine, and then practicing that at home with their parents, and their parents reinforcing that. And then you have, instead of this negative vicious circle with everybody avoiding things and everybody feeling overwhelmed and everybody feeling stressed, parents being proud of their kids because their kids are facing their worries, kids feeling really good about that, and everybody working together to succeed more and more with that approach.
Now, what do you do if you're a very anxious mother or father, and maybe you struggle more with anxiety than your child does? How important is it for a parent to get help from themselves before or after or during helping their child?
That's a great question, Meg. And I think sometimes as part of my initial comprehensive evaluation, one of the things that I do that is equally or more important than talking to parents about what their kids can do is exploring with parents whether their own anxiety or other psychiatric issues are getting in the way of their kids. And most parents have some idea of that. And as they talk to me about that, in essence, what I say to them is something like, being a parent, as you know, is one of the toughest but most wonderful things in the world. And I know you know that, having kids yourself, and I know that, having kids myself. And when your kids are hurting, it makes it even harder to be a good parent.
It's horrible.
So the first thing that you have to do is to make sure you're on the top of your own game. and treating yourself first. And that is all the lifestyle approaches that I mentioned, the exercise, the sleep, staying away from screens, socializing with the family, learning strategies like meditative breathing. And then if that isn't working, seeing a therapist who can help you with an anxiety and or your physician to look at medicines. And by treating yourself, you're going to do amazing things for your kids.
How does a parent find a good psychiatrist or therapist for their children or their child and for themselves? What do they look for in a therapist or psychiatrist?
Really good question. In general, my framework about that is something along the lines of when you see a good therapist or a good psychiatrist, the first thing is they're going to do a good and thorough evaluation. And after that, they're going to talk about an individualized treatment plan that's comprehensive, and it's going to make sense to you. Mm-hmm. And if it doesn't make logical sense, if they can't talk to you in ways that you understand about the best way to help treat their kids or themselves, then you should be looking for somebody else. The other way is talking to friends and family in the community or your primary care physician, because people have reputations, community knows, and you'd be surprised how many friends, family, relatives have had kids or themselves who have had anxiety. And so they've had experiences with providers who hopefully are good. If you're still looking for other ways, the American Academy of Child and Adolescent Psychiatry has a website with providers in different areas around the country. So does the American Psychiatric Association.
Wonderful. And, as a primary care provider, I'm very concerned about that because I've seen some children who have anxiety will go to a therapist and maybe it takes several years for them to get better. And then some kids, it's in a shorter amount of time. And I do think it's important as a parent goes into a therapist or psychiatrist to say, what is my diagnosis? How do you intend to treat it? And how long do you anticipate that? So you need that plan. It shouldn't be just like going in and having this open-ended conversation with somebody month after month after month. This is a treatable issue here. So I'm glad to hear you say to our audience, here what your expectations should be, and find somebody who can really assure you or reassure you that they have a plan and that to the best of their ability, they're going to work that plan. And here's what you should be able to anticipate. Now, obviously, things don't always go the way we want them to. But in other words, it really shouldn't just be an open-ended conversation about a child's anxiety for months and months and months.
That doesn't make sense. There should be a game plan of getting from A to B and B to C and C to D. Now, as you said, it doesn't go exactly according to plan, but it should be able to be articulated and it should make sense.
Yes.
And if that's the case, you work with that provider. If it doesn't, you are a strong advocate and look for somebody else.
Yes, exactly. Talk to me for a couple minutes, please, about omega-3s and anxiety and medication use in children with anxiety.
Omega-3s have been utilized in medicine for a long time, primarily starting with cardiology and lowering triglycerides. They've been used in psychiatry and brain areas. The largest body of data looks at helping with mood and mood disorders. The second largest body of data looks at helping with ADHD. And then there is more anecdotal and less large amounts of data looking at anxiety, but I think it has anecdotal evidence and it's very benign. If you go beyond that and talk about medicines, people have vast different perspectives about medicines. Mm-hmm. And if you look at hard data, 70% of kids, give or take, who go through good cognitive behavioral therapy can be treated with that without additional medicines. But then there's that, significant minority who have more severe anxiety, or for whatever reason their anxiety just doesn't respond to cognitive behavioral therapy and the lifestyle approaches that we talked about. And then medicines can be phenomenally helpful. And the medicines of first choice when you look at all anxieties are a group of medicines called SSRIs, and that stands for selective serotonin reuptake inhibitors. Mm-hmm. And they're a type of medicine that is classified as antidepressants. And they do help depression, but if you look at data in kids, they're even more effective in treating anxiety.
Mm-hmm.
And there's a number of those that have been well studied, and as one part of a comprehensive treatment program can be phenomenally helpful.
Because I know, it's a lot. It's hard for a lot of parents to think, gosh, I don't want to, over medicate my children. And you see that fear in parents, and I see that fear in parents. But you and I have also seen the success in treatment, and that there are times when you really can help a child by giving them medication. And obviously, it's never a first choice unless a child, I guess, is really out of control or, something else is going. There's a lot of comorbidity and other issues going on as well. But I do think it's important for parents to understand they can be safely used under the guidance of a very good psychiatrist and or their pediatrician. When you're talking about omega-3s and use, are you talking about flaxseed oil, fish oil, and what dosage are we talking about as being helpful for children with anxiety, depression, and ADHD? Because I know there's evidence that it really helps ADHD and depression as well.
There is, and probably more evidence, like I said, in terms of ADHD and depression. But the largest look at those, and it does come from flaxseed, as you mentioned, but it also comes from marine sources, and that fish oil is probably the best well-studied.
Okay.
And if you look at the active ingredients, it gets broken down in two active ingredients called EPA and DHA. And you want those two active ingredients to be in a ratio of about 60% EPA or greater, and the rest DHA. And then the lower dose of therapeutic range is about 1,000 milligrams of EPA and DHA per day.
Combined.
And combined. In a 60% ratio or 60% or greater EPA. And the 1,000 milligrams you want to give 4 to 6 weeks, probably 6 weeks, to know full effectiveness. And then if you're not having the benefits you want to see, you nudge that up gradually to 2,000 milligrams. And again, give it 4 to 6 weeks. If you're not getting the benefits that you see, you nudge that up gradually to 3,000 milligrams of EPA and DHA combined. And if you're not getting the benefits you want to see there, it's unlikely in typical kids that you'll get a lot more benefits. You might see some outliers, but the typical group, if you're going to see benefits in that range.
Up to, you're saying 3 to 4?
3,000.
3,000.
3,000 milligrams.
Now, I know for ADHD and depression, don't you usually go higher?
Yeah, no, that's for depression. There is data more looking at adults than kids going up to 10,000 milligrams a day, which is a huge amount of omegas. But with kids, the largest body of data would say somewhere between 1,000 and 3,000 milligrams of EPA and DHA combined.
Excellent.
Very helpful, very benign. If you give too much at one point, might bug people's guts. It might cause you to bruise and bleed a little bit easier. In a young, healthy kid, it's not an issue. Very benign, can be very helpful as one part of treatment.
Sandra, you've said that anxiety comes to children, or at least it is exacerbated by too much overstimulation and having a fear response to many things around them. So talk to me about what we can do to help calm our child's world, how we can impose some rhythm. And I know that you have done a lot of work with mindfulness. Can you talk about calming our children and teaching them to be mindful?
Absolutely, Meg. I appreciate the question. We live in this really overstimulating world, as we all know. And we don't always have time to think and to be aware of things. And there's a whole framework that is very research-driven called mindfulness. And it's a framework that comes from meditation in different formats. And in essence, it teaches kids to do certain things, usually using a focus of their breathing. And in doing so, it helps them relax. It helps them engage those frontal parts of their brain that are healthy in decision-making and planning. It helps them downregulate that amygdala or the alarm center in their brain. And kids as young as 5 and 6 can be taught simple frameworks of mindfulness with breathing. There's some really cool things like hot chocolate breathing, where you have kids get some hot chocolate and they first smell it through their nose and then they blow out on it, cool it down a few times, and then they do that 3 times, just enjoying the feelings, and they take a little sip. And that's one of the ways of introducing kids to mindfulness at an early age that is really enjoyable.
So there are probably some parents out there that may be doing with their kids already. They just don't know that they're doing it, and they don't know how they can utilize that even more to calm their kids and also to just sort of bring some order to their world and to decrease the stimulation that's triggering a lot of anxiety. I know that you've treated anxiety for many years, and I'm sure that there's somebody listening today who's thinking, well, okay, that's great, but you just don't understand. My child's out of control, and my anxiety is out of control. And a lot of times anxiety says to you, it's hopeless. What would you say to that person?
I would say both all of the research and all of my clinical experience disagrees with that. I am so hopeful that when kids and families get the treatment that they need, that in the long run, the majority of kids do fantastic. It's just amazing to me, the progression, and I've had the pleasure to work with kids in one place over 25 years, so I've really had a chance to see that. And I would tell parents who themselves have anxiety or have kids who have anxiety that it absolutely can get better. It might take a little time, it might take a little work, but it absolutely can get better if they're willing to make that commitment to themselves and their kids.
And you've seen enormous transformations in people's lives because you've been doing it long enough, right? You've seen children who were terribly anxious in their early years grow up and be fairly non-anxious adults. Is that correct?
Absolutely. Kids who are so overwhelmed by their anxiety that they would waste, if you will, 5, 6, 8 hours a day being non-functional because of it, who now would say to me, because we're close and we form relationships and they come into town and like to say hi to me, that they might have a little anxiety around the edges, 3 or maybe 5 minutes of noticing things. But a little bit of anxiety is a good thing. In essence, it helps keep us on the right track. It helps us modulate things. And they get to the point where they're in control of their anxiety as opposed to their anxiety controlling them.
I love it. They're in charge of their anxiety. Anxiety isn't in charge of them. And it's really shrinking the beast, isn't it?
Absolutely.
It's the beast of anxiety or the beast of depression or the beast of ADHD. It's all about helping the child be in charge or the parent be in charge and shrinking that beast. Well, Sander, this has been so helpful for me. And I really feel like I've learned a lot about anxiety in kids as well. And I'm so grateful that you came and educated us because so many times I think, when a parent sees anxiety or worries about it in their child, it triggers them to be afraid. So they want to avoid it. And your message is don't do that.
Exactly.
Deal with what your kid has. You can deal with it. You can help them deal with it. And there is excellent treatment and you can help them get through this and get past this. And I just appreciate all your expertise and how beautifully you articulate and advocate for kids. So, Sander, this has just been a wonderful and very eye-opening session for me. Thanks so much for coming.
Oh, Meg, thank you so much for allowing me to be on your podcast. I appreciate it.
All right, parents, let's get social. I want to hear from you and interact with you. You can connect with me on Facebook, Twitter, and Instagram at Meg Meeker MD. Or if you have a question, send it to askmeg@megmeekermd.com. Today I have a question from Diane who writes, I'm looking for guidance regarding our daughter. My husband and I have 3 daughters. The oldest is age 10 and she's gifted. All 3 girls are smart in their own ways, but the oldest has social and communication challenges that cause difficulty for many gifted children. We're having a tough time getting her to follow through with chores and homework without constant reminders or a battle. We've read parenting books geared towards gifted children and have tried multiple tricks, but none seem to help. We still have to remind her about picking up a wet towel, brushing her teeth, feeding the dogs multiple times every day. She's a bright girl who tested very high on her IQ test, and I know she processes things differently, but we're getting very tired and patient and wearing thin. Any help is greatly appreciated. Well, Diane, I have a number of kids in my practice just like your daughter. And first and foremost, I applaud you for understanding that your daughter is cognitively wired very differently. Her brain wiring is different from other kids. That said, we never want that to be an excuse for bad behavior. But understanding that your daughter is wired differently neurologically helps you understand that it may take longer to train her to be responsible. It'll take longer to teach her to remember things and to take responsibility for different things. So you can get there. It's just going to take longer than it would with a child who had a different neurologic skill set. Here's what I would strongly encourage you to do. First of all, the only way to change any child's behavior is by reward or consequence. So I would encourage you to come up with a reward system that would work for her around specific tasks. You can even post it on the refrigerator. If you pick up your room every day for a week, then you will get this reward at the end of the week. I will take you out to lunch next week. You can have a friend come and spend the night on Friday night. And if you don't pick up your room every day this week, then you won't be able to have a friend over Friday night, or you'll have to have lunch at school. Actually, I would encourage you not to use time with you as a reward or punishment. That was not a good example. But you know what I'm getting at. Find out some positive reward that would motivate her to stay on task, and have her practice that over and over and over, and keep a list. When she's successful at a task, she checks off the box on the fridge. If she is unsuccessful, she fails to follow through, then the consequence happens at the end of the week. Second thing that's very important to do with your child is kids like your daughter get overwhelmed if they're required to do too many things. They'll forget everything. So simplicity is best. I would choose the behavior that she's following down on that is most offensive to her. For many children like your daughter, it's forgetting to turn in their homework. So I will use this as an example. I would say to your daughter, for the next month, 4 weeks, I am going to help you work on turning your homework in every single day. We're not going to worry about picking up your room. We're not going to worry about feeding the dog. We're not going to worry about other chores. I am going to help you as your mom or dad be successful with this one behavior. I want to teach you how to follow through with this. So here's what we're going to do. And then you sit down with her and you construct a plan of success for her. And that plan of success would include something like, every morning, I'm going to ask you if you remember to bring your homework home. I would have a little notebook that she takes to school, and she writes down what her homework is going to be. I would also alert her teacher to the fact that she's having difficulty remembering to bring her homework home. So I would ask the teacher, would you go along with us here? And before she leaves, ask if she has her homework. So you're implementing some strategies along the way to help her succeed. When she comes home at night after school, did you bring your homework in? And then as she leaves the next day for school, do you have your homework that you're going to take back in order to turn in today, the homework that you did last night? So in other words, you are her partner in this battle for her to help remember to turn in her homework. You implement success strategies along the way, and you focus on changing this behavior, this one behavior, for 1 month, and you forget everything else. This is how you really help kids succeed, gain confidence that they can succeed, and stay on track. You're really helping her develop some real helpful attention skills here. Once she's successful in one area that's very important to her, then you move on to another area. That's when you say, okay, you've done really beautifully turning in all your homework. Now we're going to work on keeping your room clean. But I will tell you, kids who are like your daughter have real difficulty succeeding at multiple tasks at once. It's too much for their young brains. And that's the best way that I know to help you succeed with your daughter. Parents, I love answering your questions, so keep sending them in to me. You can email me any question at askmeg@megmeekermd.com. askmeg@megmeekermd.com. I want to thank my guest, Dr. Sandra Weckstein. What a wonderful episode this has been. I will tell you, I have personally struggled with anxiety, so I really appreciate anybody coming on and helping me with my own anxiety. And it also helps me with my patients in my practice, because the truth of the matter is, friends, 99% of us are going to struggle with anxiety at some point in our life. Friends, Sandra possesses a wealth of knowledge in this area, and I am so excited that he agreed to join me and that you got to listen in on my conversation with him here on Parenting Great Kids. I can't wait to have him share more. So let's recap my points to ponder. 1, never be afraid to see anxiety in your child. 2, your child needs you to take control of the stimulation in his world. 3, start with the basic 4. Good food, good sleep, good exercise, and good connection with you. So until next time, parents, remember, great kids are raised, not born.
Hey, this is Bobby, producer of Meg Meeker's Parenting Great Kids podcast. We hope you've enjoyed listening to episode 47, Children and Anxiety. And thanks to you, Dr. Meg's Parenting Revolution has grown to over 1 million downloads. You can like Dr. Meeker on Facebook and follow her on Twitter and Instagram at MegMeekerMD. As a reminder, go to MegMeekerMD.com and sign up for her newsletter for giveaway opportunities and updates. And don't forget to share the podcast, write us a review, and click subscribe so you won't miss an episode.